Here is a question nobody in the detox industry wants you to ask. If your liver is already overwhelmed with toxins, if it has been silently accumulating poison for years, why does it only need one weekend and a bottle of olive oil to fix that? Why would an organ that has been failing you for decades suddenly reset itself in 48 hours? It would not. And the reason it would not is because that is not how your liver works. Your liver is not a storage tank. It is not sitting there, quietly collecting toxins the way a drain collects hair, waiting for you to notice the slowdown and do something about it. It is an industrial processing facility that never closes. Right now, while you are reading this, your liver is running compounds through what biochemists call Phase 1 and Phase 2 detoxification pathways. Phase 1, driven largely by a family of enzymes called cytochrome P450, takes drugs, hormones, alcohol, environmental chemicals, and the metabolic waste your own body produces, and chemically modifies them. It oxidizes them, reduces them, breaks them apart. Then Phase 2 takes those modified compounds and conjugates them, essentially attaching molecular tags like glucuronic acid, sulfate, or glutathione, which makes them water-soluble. Once they are water-soluble, your body can actually move them out. They leave through your bile into your stool, or through your kidneys into your urine. That is the flush. It is happening continuously, not on a schedule you set. So, when you feel tired, foggy, broken out across your chin, bloated, heavy, sluggish, and someone tells you that is what a toxic liver feels like, they are not lying to you exactly. They are just leaving out everything else those symptoms could mean. Fatigue is a symptom of anemia, thyroid disease, poor sleep, depression, and 100 other things. Brain fog shows up with blood sugar instability, inflammation, and inadequate protein. Acne responds to hormones, stress, and diet composition. None of these symptoms are validated markers of impaired hepatic detoxification. Real liver dysfunction is evaluated with blood tests, aminotransferases, bilirubin levels, imaging, not a checklist of complaints that could describe almost any adult on a bad week. And then there is the flush itself, the signature move. You drink a mixture of olive oil and citrus juice, you go to sleep, and in the morning you see green lumps in the toilet, the proof, the evidence that something was cleared out. Except chemical analysis of those lumps tells a different story. They are saponified complexes, soap-like blobs formed in your intestine when the fat from the olive oil reacts with the minerals in your gut contents. They are not pre-existing gallstones. Real gallstones are dense, often calcified, hard enough that they do not dissolve overnight and cannot be flushed out through your bile ducts without serious medical risk. What you are seeing is the product of a chemical reaction inside your gut, not a debris field from your liver finally coming clean. None of this means your liver cannot become genuinely overburdened. It absolutely can. But the mechanism is not mysterious toxin accumulation. The most widespread and meaningful version of a truly impaired liver is something called MASLD, a metabolic dysfunction-associated steatotic liver disease, which most people still know by its older name, fatty liver disease. It now affects roughly 30% of adults in Western countries, making it the most common chronic liver condition in the world. What happens in MASLD is that excess fat accumulates inside liver cells, driven by central obesity, insulin resistance, type 2 diabetes, and poor metabolic health over years and decades. That fat load gradually impairs the liver's normal function. In more serious cases, it progresses to inflammation, fibrosis, and scarring. It is a slow, metabolic process built from the accumulation of daily habits across a long stretch of time, not from missing a cleanse. That distinction matters enormously because it changes what actually helps. If the liver becomes overburdened through sustained metabolic stress, then supporting it means addressing that metabolic stress. It means the kind of changes that work over months and years, not the kind that promise results before Monday. There is no compound you can drink on Saturday that counteracts what is happening in your hepatocytes across a decade of dietary pattern and physical inactivity. Supporting liver detox is not about forcing a reset. It is about making the environment your liver operates in less hostile over time. And the evidence for what does that and what makes it worse, including some of the products being sold as solutions, is a lot more specific than most people realize. So let us get specific, because the difference between what actually works and what is being sold as working is not a matter of opinion. It is a matter of evidence. And once you see the separation clearly, it becomes very difficult to take the detox shelf at the pharmacy seriously. The strongest levers for liver health are almost aggressively boring. Limit alcohol. That is not a suggestion with asterisks attached. Alcohol is directly hepatotoxic, and there is no safe threshold for a liver that is already under metabolic pressure. Avoid unnecessary medications and supplements, especially in combination, because the liver processes every single one of them, and both prescription drugs and products labeled natural are documented causes of drug-induced liver injury. Maintain a healthy weight. Manage insulin resistance and diabetes if they are present. Sleep adequately, because sleep deprivation impairs metabolic regulation and compounds the same pathways that drive MASLD. Eat in a way that includes fiber, fruits, vegetables, and enough protein, with the Mediterranean dietary pattern showing the strongest consistent evidence for reducing liver fat and improving liver enzymes over time. These are not interesting. They are not going to be featured in a 30-second ad, but they are what the research actually points to. For people with MASLD specifically, the fix is even more precise. The target in most guidelines is sustained weight loss of around 7 to 10% of body weight, achieved gradually through caloric reduction and increased physical activity. Not a weekend fast, not a 21-day cleanse. 7 to 10% held over months is what studies associate with measurable reductions in liver fat, improvements in aminotransferase levels, and in some cases, histological improvement. That's meaning actual changes in the tissue itself. That is the detox. It is a long, metabolic, unglamorous process, and it works. Now, there are some things worth separating from the noise, because they have real but specific evidence behind them. N-acetylcysteine, NAC, is a genuine medical intervention for acetaminophen overdose. It works by replenishing glutathione in the liver, the very same conjugation molecule involved in phase 2 detoxification, and when administered within the right time window under medical supervision, it can prevent catastrophic liver necrosis. That is a powerful, targeted tool in an emergency setting. It is not a reason to take NAC capsules as a casual morning supplement. The evidence is not the same. Adequate dietary protein and choline are legitimate nutritional supports for liver function, because the liver requires them for basic metabolic operations, including fat export and membrane integrity. And daily coffee, roughly 2 to 3 cups, is one of the more surprising consistent findings in liver research. Observational data and meta-analyses link regular coffee consumption to lower liver enzyme levels, less fibrosis, reduced cirrhosis risk, and a substantially lower risk of hepatocellular carcinoma. The benefit appears to be long-term and cumulative, not an acute flush effect. Drink it because you enjoy it, and it may quietly do your liver a favor over the next decade. Do not drink it because someone told you it is a detox. Then, there is everything being sold as a solution. Liver detox teas, juice cleanses, extreme fasts, high-dose supplement stacks, and coffee enemas share something in common. Yeah, none of them have robust clinical trial evidence showing objective improvement in liver function, and some of them have documented cases of causing liver injury. There are published case reports of cholestatic liver injury triggered specifically by over-the-counter detox teas. Coffee enemas, which retain a following in alternative health circles, are associated with colitis, proctitis, serious electrolyte disturbances, infection, burns from improperly heated liquid, and recorded deaths. The Cleveland Clinic and mainstream medical bodies advise against them. These are not theoretical risks being invented to dismiss a trend. They are documented harms from products sold under the premise of protection. Botanicals like milk thistle, artichoke extract, yaw and turmeric get brought up frequently because they have been studied and because some of the preclinical data looks interesting. But the honest summary of human evidence is that it is limited, heterogeneous, and often low quality. Systematic reviews regularly conclude that there is insufficient evidence to recommend them as treatments. Product quality varies enormously, dosing is inconsistent, and there are occasional liver injury signals even from these supposedly gentle options. If you want to use them, that is a conversation to have with a physician who knows your full picture. They are not a substitute for the habits described above. Here is what should actually send you to a doctor immediately: yellowing of the skin or eyes, dark urine paired with pale or clay-colored stools, severe pain in the upper right abdomen, are persistent vomiting, confusion or mental status changes, significant swelling in the abdomen, any of these symptoms following a suspected overdose, heavy alcohol use, or a new supplement or medication. These are not signs of a liver that needs a cleanse. They are signs of a liver that needs medical evaluation now, and delaying that evaluation to try a product first is one of the most dangerous things the detox industry quietly enables. Your liver has been working without a day off since before you were born. It does not need you to force it to do anything. It needs you to stop making its environment harder to survive in. The daily habits are the intervention. That is the whole answer, and it has been the answer all along.